I want to talk today about expanders. Why are they needed? I got an expander. This is what an expander is. It is custom made for each patient. It has a jack screw in the middle of the roof of the mouth. It comes with a key and the parents have to turn. I have some patients that turn by themselves. There are some designs that make a little click when you turn, so it's easy to know when you did a complete turn. I expanded all my 3 children. If I really think about it, I would have benefit of having an expander myself. But since I had treatment in my late 20s, it should have been done surgically. I was not ready for that. Nowadays we have expanders that are anchored on mini implants for the older adults to somehow be able to avoid, if we can, the surgical option. But there is a huge need to see these kids early and diagnose crowding, diagnose if they have crossbites, and also some of them will have impactions, meaning you take an x-ray and you see permanent teeth that are stuck underneath the baby teeth. You need to extract baby teeth, you need to expand, and most of the time this is enough to prevent cuspid exposures and impactions. But that's the need for expansion. And usually what we see in the orthodontic literature, about more than 60% of patients that are walking in an orthodontic practice, more than 60% of consecutive 100 initial exam patients, consultations, they need expansion. We kind of look at the teeth in all 3 dimensions, like having the face, the teeth in a box, front and back, left and right. That's the transfers, the need for an expander. And the up and down, how big of an overlap we have between the upper and lower teeth. There are some designs that have a pre-adjusted screw, which I think we're going to have to move to so we can eliminate the human error, the parents learning how to do the turns. And you can get them pre-activated for a certain number of millimeters, whether it's 7 millimeters or 10 millimeters, something like that. You're going to see space developing between the 2 front teeth. Everything is temporary. We are temporary. The braces are temporary. The expanders are temporary. So as long as we tell them ahead of time, then yes, there's going to be some space in between the 2 front teeth. Don't worry about it. It will close. I think we'll be okay. I think every child should have a consultation around the age of 8 to kind of evaluate in what direction they're growing, and if there is a need for an expander or baby teeth extractions. In the end, it's all about the face and the dentition. I'm talking about the permanent dentition. The primary dentition is there, temporary. And we want a good bite with a good face. And it's nice to kind of start planning ahead of time.